All right, well, good afternoon. I'm joined today by Ted Phillips, who's led the housing security effort in this city at UCHC, Gary Brown, who has done a great job with the Detroit Water Department, a face from the past, our former health director, Dr. Abdul El Sayed, and then our current health director, Denise Fair, will join us when we're done. I am going to start on something that I hadn't planned to talk about today, but this community got very sad news. One of the great public servants that Michigan has ever known, Jewel Ware, passed away today. She's been my friend and a county commissioner for nearly 30 years, and she was the best friend of senior citizens in this city. Anybody needed food, Jewel Ware was there passing it out. If you had trouble with your health insurance, she worked it until it got solved. Every senior in her area knew if they had a problem, they could go to her. Does not appear to be in any way COVID related, but it was a shock. I spent time with her even in the past week, and we did not see this coming. She was a huge supporter of mine when I first ran in 13 and again in 17. One of my most trusted advisors, and probably the hardest thing right now is I think back to July of 2019, last year, when we had the presidential debate in Detroit. And you remember Joe Biden at the first debate did not have his best performance, and conventional wisdom was he was done. He came into the Detroit debate. And I was supporting him, and Jewel was supporting him. And the morning after the debate, he kind of had a little victory reception at Coney Island along Woodward, and Jewel and I were there, and he said to us, "I think you were the first two elected officials of Michigan to endorse me." And Jewel said, "It's going to make me all the happier when you win." And so I'm glad she got to see the election. I wish she had had a chance to see Joe Biden take the oath of office, but to her family and friends, just want you to know we're thinking about Jewel, and she's going to be deeply missed. And in that same vein, everybody in this town should keep Benny Napoleon in their thoughts and prayers. The indications I'm getting from the family members are that he continues to improve, but he is not out of danger. He does have COVID, as you know. I think you probably know his brother was on a ventilator for more than 2 months. I think the treatments have improved since then. But we still have a ways to go in fighting this. And so I want Benny to know that we're thinking about him. Let me show you where we stand today on COVID. And I'm going to continue to talk about what we need to do. And so if you look at the national maps, and I will keep showing this over and over at the spread, this is the New York Times COVID map. The redder it is, the more intense the infection rate. That was approximately 3 weeks ago in November. Here's how the country looks today. This is the reason you're hearing about nighttime curfews in California and shutdowns in New Mexico. It has continued to get worse nationally because, of course, there is a complete lack of national leadership in trying to address this, which means that essentially the White House has said it's up to states and cities, go fend for yourselves. And I'm going to keep talking to the people of Detroit. Let's control what we can control. We can't control what's going on in Ohio and Indiana and Wisconsin. We can control what's going on in Detroit. And the lines are coming up and they're starting to concern us. This is the number of people who died each day. Last April, we were losing 50 of our neighbors a day. We've gone down quite a bit, and on the right hand, we show you the number we've lost per week. And you can see we've gone from 2 or 3 a week to 7 a week to now 13 and 15 a week. So it's about 2 people a day we're losing to COVID in Detroit. That's 2 too many. But you can see that is not a trend we want. It's not 50 a day, it's 2 a day, but it's starting to trend up. We can control this with the choices that we make. And the evidence of that continues to be the latest infection rate numbers. The city of Detroit, our positive COVID infection rate, this is the state of Michigan data, continues to be dramatically lower than the surrounding communities. That is absolutely a function of folks who think they might be sick going to the Walker Rec Center and getting prompt testing and quarantining when they find out they're positive. It's a function of people wearing masks and social distancing every day. We have made a plea in the last 2 or 3 weeks, and particularly with Thanksgiving, which had us concerned. And I want to show you what I think is early signs that your choices matter. What we are doing in Detroit matters. This is the number of people hospitalized in Detroit hospitals every day. And it was doubling every 4 weeks. And I showed you before, on November 7th, we had 116 Detroiters hospitalized at our hospital. By November 24th, that had basically doubled to 203. And by December 1st, it had gone up to 236. We were on a rate of doubling about every 4 weeks. If that had continued, by the end of December, we would have been in crisis mode. Now, it's early, it's a week later, but 1 week later, December 8th, we have 228. We don't know for sure this is a leveling, because if people did gather on Thanksgiving, it's still going to be another week before we see the effects of that. But there is no doubt in my mind that choices Detroiters are making to protect each other. And please, when you're with groups indoors, wear the mask. Most of the spread is occurring in people without masks indoors. But again, you look at what's happening in the rest of the country, you look at what's happening here, and we study this data every single day. Your choices as Detroiters are what are driving these trends, nothing else. And we need to keep doing what we're doing. The stakes are just too high. And I want to talk to you a little bit about vaccines. If you watch some of the TV shows, you think the vaccines are just around the corner. I don't believe it. I think the vaccines are excellent. I think what Pfizer and Moderna have done have been outstanding. They've treated nearly 35,000 people with their vaccine, and only 13 people actually got COVID. When it comes, I'm going to be the first one to sign up to get vaccinated. But the reality is, there is not a plan in this country to get the vaccines out to folks and get the general population vaccinated. I do think we'll probably see some hospital workers before the end of the month, but I think for most people in Detroit, you're probably not going to get a chance to get a vaccine before March or April. And that means we have to keep up these safe behaviors. There is, however, one other thing we can do. And this is going to seem a little off the subject, but I just need to try as best I can to give you a sense of the health challenges that we face. Because every year at this time, we're not talking about COVID, we're talking about seasonal flu. I ran hospitals for 9 years. We would track these seasonal flu trends, and they were almost like clockwork. So this is something the CDC puts out. It's the seasonal flu map, nothing to do with COVID. This is the regular seasonal flu everybody's used to. And when you're green, you have no infections, and it ultimately turns red. This is last week's seasonal flu map. You can go to the CDC website. You can see this map right now, public document. And you can see in Michigan, we have, it's green. We don't have a lot of seasonal flu. You don't know a lot of your friends who have seasonal flu. Last year at the same time, Michigan was green as well. Typically in Michigan, we do not see seasonal flu in November and early December. It hits us later. The time to get your flu shot is not after you've had the flu, because I want to show you what happened in the past. So this is the way it looks today. Michigan's green. Here's last February, February 1, this last year, before COVID even hit. This is how the flu map looked, and you can see Michigan, dark orange. We had a lot of people in the hospital last February with the flu. You can see what the problem is going to be. If we don't slow the traditional spread of the seasonal flu, and COVID picks back up in January or February, we're going to have a crisis in hospital capacity. And I know Denise Fair has talked about this before, and she's going to talk about it again. But go up to your local pharmacy or doctor. get your seasonal flu shot. And I've gotten them every year for the last 15 years. They're safe, they're reliable, and they will be sure that we won't have people either in the hospital for seasonal flu, or if somebody does have to be treated in COVID, the hospitals aren't already overwhelmed. We've got a 3 or 4 month, very challenging period still in front of us with COVID. When the vaccines start, Detroit's going to be at the forefront. We are ready with the TCF Center, with the Comerica Park garages, to vaccinate 5,000 people a day at whatever point the federal government can get us the vaccines. But it's going to be a few months until we get there. You can help now by going up and getting your seasonal flu shot. And the things that I want to talk about today is how we watch out for our neighbors over the next 3 or 4 months. The governor extended the shutdown another 12 days of our restaurants, our casinos, some of the businesses. And that puts significant economic pressure on everybody. We got to keep bending this curve. But now that makes it that many more people having trouble paying their rent, that many more people having trouble paying their water bills. And so we're going to talk to you right now about what you can be doing. If you are afraid of eviction, let's talk about what the city is here to do. If you're worried about making your tax payments, here's what we're ready to do. So let me start with what's been called the HPTAP program. I have no idea who invented this name, but what it means is this. If you have low income, you can get a break and not pay your property taxes in the city of Detroit. December 14th, you've got another week to do this. And you could get anywhere from 25 to 100% of your property tax bill canceled. This, by and large, is enormously important for seniors who maybe bought their house when they were working, are living on Social Security now, own their house, and are having trouble with property taxes. Or it could be anybody who lost their job and needs to be making those property tax payments. So if you're an individual making less than $22,000 a year, or a family of 4 making less than $32,000 a year, go out in the next week and apply for this. We will help you through the process, and we will cut your taxes. We want to keep you in your house. We do not need any more vacant houses in the city of Detroit. So you can complete your application in 2 ways. One is you can go to our website, and it isn't that hard to do, or you can go in person. We were doing this at City Hall, but the lines have gotten so long, we've moved it over to the TCF Center because we want to make sure you can safely space out. And so if you go over to the TCF Center Monday through Friday between 9 and 4, we will absolutely take you through this in a COVID-safe manner and make sure that you don't have to pay taxes that you don't owe. And so you go online and we'll show you the documents. Here's the other thing we want to do. We are right now fighting in Lansing to make your tax exemption. If you get it done this year, it'll cover next year too, because usually you have to fill it out by state law every year. We have a bill in the state legislature right now that says that we would like to be able to have this year's exemption cover next year. So you don't have to go do this again. You don't have to come back down in COVID and file a second time. And so Senate Bill 1234 went through by a 35-0 vote last week. Got it through the Senate. We've got to get it through the House. And I don't know if you've heard, but thanks to the visit of Rudy Giuliani, the House isn't in session this week. And so we're going to have to, with a very tight House agenda, hopefully get our House members to take it up. And so for the 9,000 of you who have these exemptions, you'll get an automatic exemption again next year. And I want to thank Stephanie Chang and our Detroit delegation that have been leading the fight on this legislation. Here's the other thing the law would do. If you're relying entirely on Social Security or disability, when you get the exemption, it'll last 3 years. If you're 78 years old collecting your Social Security check, you're not likely to get a job at the FCA plan or Amazon next year. And so we just think once you fill this out once, it should last for 3 years. If you go get a new job, you have to come off this. But right now the law says you have to go through this process each year. Now we'll only have to do it once every 3 years. And so we hope the House members are healthy, and we hope they make this a priority when they come back. If you are a renter, 36th District Court reopens right now on January 4th. So if you've gotten an eviction notice, don't wait till January 4th when you get your court hearing. We want you to contact us right now because the city of Detroit has a major eviction diversion program. You can go to DetroitEvictionHelp.com or call this number. You get both legal help in court and you can get help with your rent arrearage. And the organization that has been leading this effort is UCHC. Ted Phillips has been providing legal representation to lots of folks in this town, working out these agreements and preventing evictions. And with that, I'll turn it over to Ted to get his thoughts on what we want to do to make sure we keep you in your rental property. Ted?
Thank you, Mayor. Yes, January 4th is when the court will be back open, but absolutely you don't want to wait until then. The eviction diversion program that's funded by the state ends on December the 30th. The city is working on a replacement program. I thank the mayor, I thank the HRD department for that, but it's not likely that there's going to be unlimited funds, so it is extremely important for people to get in now. We do know that there's about 3,000 cases that were set for a first hearing from November the 18th when the court closed to the end of the year. Those cases will all be put over to January. Those individuals will all get new notices, but don't be confused by them. You still need to take action now, and there's a lot of help out there now to take care of paying your rent. That rent assistance will apply basically to cases for non-payment of rent. You should have received a notice to know that's the type of case you have. But there's other things that can be done with the attorneys we have and the other attorneys working on this project. There are some landlords that filed different types of cases, but after a little negotiations, they've been willing to convert them to non-payments. So don't just give up just because you're confused by what type of case you might have. We will be doing outreach letters to all of the people that have cases that are put over. You will be getting something shortly from a coalition of folks led by the United Community Housing Coalition, Michigan Legal Services, and Lakeshore Legal Aid. But don't wait for the letter. I mean, you've got the information now as to where to call and where to go, so take advantage of that. When court comes back in session, we will continue to provide help in court. At the last juncture when we were in court, Lakeshore Legal Aid, UCHC, and Michigan Legal Services had attorneys available at all of the virtual hearings. There was 2 to 3, sometimes more than that, attorneys in the courtroom. If you appear and are not represented, the judge will usually ask you if you want counsel, and if you ask for that, you'll be assigned to one of us. It will be more difficult in January, however, so it's another reason for acting right now, because we know there's going to be a lot more cases at that point in time than there have been in the last several weeks and months. Lastly, we have seen many persons with Section 8 and other kinds of subsidy, public housing subsidy and the like. In your situations, you are covered by the eviction diversion program as well, so know that. But in addition, we've seen many persons in that situation that have had interruptions in their income. You're a little different than others. In your situation, if you report that to your Section 8 agent, or if you're living in a site-based situation, a building of seniors where everybody is subsidized, then report that to your landlord immediately, because they can adjust your rent by the first of the next month once you do that. So don't just continue to fall behind. Report that. Many Section 8 landlords, the Detroit Housing Commission and others have said that they will also make sure that it's retroactively adjusted. Don't just move. When you move out of housing like this and you owe money, it'll come back to haunt you later. I had a client just this past week that came to us sort of out of nowhere. She was homeless. She owed $69, and that was holding up her getting her Section 8 voucher for her and her 3 kids. We helped her with that, and that got resolved. But that's the kind of minuscule stuff that can ruin your life for a long time. So don't just up and move. Don't just up and move on any of these situations, but particularly those. But there is help out there. There is a need to act quickly. December 30th is a real date. There will be more done after that, but don't count on that right now. Let's work hard to get every penny spent and every person helped. If you know somebody in your neighborhood, encourage them to apply. If it's you, make sure you call us at that number that's listed on the screen. Thank you.
And so UCHC has done such phenomenal work, and they care about your situation. We're here to help you, to keep you in our homes. We are going to be moving next year on renovating the vacant homes, demolishing those that can't be saved across the city. We do not want one more vacant house. We're going to do everything we can, whether you own it and you're struggling with your taxes, or whether you're with your rental and you're struggling with your lease payment. Call this number, go on this website, and we will help. The other thing is, in this crisis, and even beyond that, water security is something that we have badly needed in Detroit. And Gary Brown had made enormous progress with the RAP program and the 1030-50 program in dramatically reducing the number of people who were facing water shutoff. But this city owes an enormous debt of gratitude to Gretchen Whitmer, who stepped in March and gave us the financial support for the $25 restart program. And since March, we have had no water shutoffs in this city for lack of funds. And with today's announcement, we're going to extend that moratorium through 2022. There will be no water shutoffs through 2022 because of anybody's inability to pay. And we're going to tell you how to access that today, and we want to make sure that there isn't any issue. But here's the significance of what the governor did. With the support last March, Gary Brown and the team went out and knocked on doors. Even if you had been shut off but you hadn't reached out, they went out and knocked on doors, found out what was going on, and reinstated 1,300 homes. And so we got everybody back on. To my knowledge, nobody in the city today is without water for lack of funds. But here's what we found. The average water bill of those who had it turned off a lot of times was running double the typical Detroiter's water bill because they had a running toilet, they had leaky pipes. The same people who are having the most trouble paying the monthly bill don't have $1,500 to fix the pipes in their houses. And so the governor came up with $6 million to let us get at the root cause, get into the house, and now the Gary Brown's team has been in and has either repaired or is in the process of repairing the pipes in 700 houses in the city. There's an environmental benefit from not wasting that water, but it also allows people to have a bill that's affordable and manageable. And the governor also provided $15 million to erase the arrearages for those with very low income, which means that the residents of this city are closer to being financially secure in their water than they've been in probably 25 years. In addition to that, we got help from the Great Lakes Water Authority, and today all Detroiters pay a 1% surcharge on your monthly bill that goes to pay to help your neighbors who cannot afford it. And with that fund, we now have enough money, we believe, to cover the cost of anybody who can't afford to pay their water. And so we have a series of programs. All you have to do is register, and the help will be there for you. We are putting a moratorium on all water shutoffs for lack of funds for the next 2 years. And then we've got to have a permanent solution. And I am absolutely committed to finding that permanent solution. And already Senator Gary Peters is taking a lead nationally. Anybody who has had problems paying their electric or heating bills in the wintertime knows that there's a federal program that's the low-income heating assistance program. And the federal government helps you pay those bills. There has been no federal assistance for water. And I think there's growing bipartisan support for that. And we're going to take the next 2 years and build a coalition so that while we've got 2 years breathing room where we're going to be okay in having a moratorium on shutoffs, we're committed to finding a permanent solution so that this problem does not come back. And with that, I want to turn it over to a man who's just done an outstanding job of getting this department in professional shape to tell you what you can do to be sure that your water remains on. Gary Brown.
Thank you, Mr. Mayor. The shutoff moratorium issued by the Michigan Department of Health and Human Services ends in 23 days, but not here in Detroit. We are continuing the moratorium through 2022 while we work on a permanent water affordability solution at the state and federal level. The infrastructure is in place through DWSD and our community partners to continue to provide compassionate and effective customer affordability programs to financially insecure Detroit households now and through the implementation of a permanent long-term solution. As the mayor indicated, the goal is to stop water shutoffs to low-income Detroiters once and for all. The COVID-19 Water Restart Plan, launched on March 9th, has restored water services at nearly 1,300 occupied homes, many of which needed plumbing repairs. The city has set aside sufficient state, federal, private, and local funds to continue the moratorium on water service interruptions even after the health department's order ends on December 31st. Since the COVID-19 pandemic began, DWSD has helped thousands of financially insecure households with water bills and emergency plumbing repairs. By the end of December, $22 million is expected to be spent, $15 million of which will go towards bill credits to nearly 50,000 Detroit households. Regardless of how low water rates are, there will always be a percentage of households that simply cannot afford to pay their water bills. Federal programs exist to support financially insecure households in obtaining food, heating, and energy, but no similar assistance is provided for the most basic life necessity, clean and safe water. The next step is to work on a permanent solution for water affordability. Detroit will be a leader at the state level and nationally. Thank you, Dr. El Sayed, for your willingness to partner with us in identifying long-term funding. Detroit has joined a coalition of cities from around the country, including Seattle, San Francisco, Philadelphia, Alexandria, Baltimore, Louisville, Sacramento, and Washington, D.C., to create a policy platform on national water affordability initiatives focusing primarily on LIWAP, low-income water affordability programs that include plumbing repairs. I also want to thank Senators Gary Peters and Debbie Stabenow for their support and willingness to lean in on this issue at the federal level. Customer affordability programs have been in existence since 2016, with some additional resources over the past few years from community partners. WRAP, the Water Residential Assistance Program, has helped more than 18,000 households get to an average bill through paying down arrears, monthly bill credit, and minor home plumbing repairs. Now, as of July 1st, households earning at or above 200% of the federal poverty level are eligible to apply. That's $52,000 annual income for a family of 4. $36,000 is what the number was last year. This also extended minor home plumbing repairs to $1,500 on average, and financial assistance opening up to at least 5,000 more Detroit households annually. More than $1 million is available in the WRAP fund right now. The Great Lakes Water Authority board allocation for the WRAP is expected to be $9.2 million regionally through 2022, with at least an additional $3.8 million earmarked for Detroit. The 1030-50 plan allows residents to enroll safely in the payment plan online and by phone. The 1030-50 plan has unlimited enrollment availability for households who need help paying down a balance but do not meet the WRAP income eligibility. The City of Detroit's Community Health Corps will help residents living in extreme poverty situations who need wraparound services by continuing to go door to door. The plan announced today is not a payment amnesty. Residential households will continue to generate their full water and sewer charges based on a monthly usage and the drainage charge using current rates. DWSD plans to leverage local, state, federal, and philanthropic resources to fill the gap to ensure residents who cannot pay today are able to maintain water service. Residential households who have the ability to pay should continue to pay their monthly bill to support maintaining and improving the water and sewer systems for you and all Detroiters. Detroiters with low income can join the program and avoid any interruption of service by contacting Wayne Metro at 313-386-9727 or visit www.waynemetro.org. In closing, I want to thank the hardworking DWSD employees and their families who have been impacted by the pandemic. Many of our field service technicians have been on the front line since the pandemic began, helping our customers resolve issues in the neighborhoods. Because of their commitment, they risk their own health and their family's health as they go to work every day to continue to provide reliable and affordable water and sewer services in Detroit despite the pandemic. We are grateful for what they do and thank each one of them as well as their families. Finally, we appreciate our customers for supporting the system and our water affordability initiatives.
And thank you, Gary. The professionalism of the department has come a long way, and you and the men and women at DWSD deserve enormous credit. In recent years, there has been no more passionate advocate for water security than our former health director, Dr. Abdul El Sayed. He made it a major campaign platform when he ran for governor. He's continually put forward plans on how you could permanently have people be able to have water and not have those bills be passed on to other Detroiters who can't afford them. The momentum is pretty remarkable. Earlier today, I was on a national call with mayors across the Midwest, including Lori Lightfoot in Chicago, who are facing the same challenges. I think we've got great momentum in Washington, D.C., but it's going to take a coalition to push this through. And so Dr. El Sayed has agreed to take a leading role in helping us build that coalition. While we can sit here today and tell you that the moratorium will protect Detroiters for the next 2 years, we need to make sure that people of this country are protected on water security permanently. And with that, I want to welcome our advocate, Dr. El Sayed.
Thank you so much, Mr. Mayor. It's an honor and privilege to be joining you all today, and really grateful for the leadership that you've shown on this issue. And Director Brown, thank you for the leadership you've shown. I had the opportunity to work with both of you when I was here at the city, and just really continue to admire the focus and the attention to detail that you pay, particularly in a moment like this. You started out, Mr. Mayor, I think rather appropriately, talking about the impact that COVID-19 has had on this city, and it forces me to reflect back to about 5 years ago when you and I met for the first time, and you asked if I might be interested in taking on the role of trying to bring back a city health department. And we sat down and didn't always agree on everything, but the thing that always brought us forward was a commitment to the health and well-being of the city. And I think today, the commitment that you've made to ending water shutoffs permanently is a down payment, yet again, on that commitment. And I can't help but admire the work that you've done, the work that Denise Fair has done in continuing to steward the health department to keep the case rates as low as they've been. And that in part reflects the work of the health department in the city, but also reflects just the trust that people in this community have in you and that health department to do the things that they need to do every day, protect themselves, their families, and their loved ones. I have to say, when I was health director, I remember one moment I'll never forget, which was walking into a home where a baby had had been lost. And in watching as that mother reflected on what it was like to lose a baby, and the work that has been done to take on the challenge of infant mortality really in the city is incredible. But I was there alongside one of our nurses, and when I had asked to use the bathroom, I came to appreciate that actually the water was not working in that home, and that moment will never leave me. And today, what we've done is said that's not going to happen anymore in the city of Detroit, and I really, really deeply appreciate that work that went into that. But I also know that there's still work left to do, because the reality is that the funding exists to get us to 2022, and the choice that we have in moving forward is the work that we choose to do to get this funded, so that no longer will we ever have a circumstance in the city where somebody goes without the basic need, the basic lifeblood that is water. I also have to just appreciate the fact that there are so many people who have done the work of bringing the challenge of water affordability to the fore, fighting for fresh water for folks. And I just want to name some of them here. A mentor of mine and a great friend, Monica Lewis-Patrick, people like Linda Campbell and Miko Williams, Nicole Small, Lila Cable, Charity Hicks, Alice Jennings, the late Miriam Mahaffey, Councilwoman Joanne Watson, the late Congressman John Conyers, Congresswoman Rashida Tlaib, State Senator Stephanie Chang, Councilwoman Raquel Castaneda Lopez, State Representative Abraham Ayash, and organizations like We the People of Detroit, Michigan Welfare Rights, the People's Water Board, the Sierra Club of Michigan, Food and Water Watch, and Hydrate Detroit. I know sometimes those folks haven't always been on the same side, but we have an opportunity moving forward to make sure that all of us are aligned to being able to secure the funds that we need to make the mayor's commitment today to end water shutoffs in Detroit a reality. And I promise that I'm going to do everything I possibly can to be a part of that effort. And I'm really grateful for the leadership that everyone here has shown, grateful for the work that has been done, and looking forward to the work that will be done to finally end water shutoffs in the city. Again, thank you, honored to be here. And I just have to echo the point, I'm still a physician and epidemiologist. Please do wear your masks, make sure that you are physically distancing. When a vaccine becomes available, make sure that you are ready in line to take it. We've got an opportunity to keep those case transmission rates low, to continue to save lives in the city. I really appreciate the work that you've done to make that happen, and looking forward to a future that's just a bit more just, equitable, and sustainable. Thank you for the down payment on that.
So as we sit here today, I can't help but think about how far we have come. There was no health department, for all practical purposes, when I got elected. It had been privatized in the last administration. I don't know, Dr. Saab, 5, 6 employees or something like that. And he had the task of rebuilding from scratch, and did such a good job that Denise Fair has been able to pick up the torch and lead a nationally recognized response to COVID. And with that, we have to, as we always do, give the final word to our current health director, Denise Fair.
Thank you, Mayor. The health department is still standing, and we are still strong with over 250 experts who are right now continuing to fight COVID-19. So I'm so glad that we are continuing to talk about the importance of flu shots. And let me just start with just some data. As of December 5th, 85,846 Detroiters have received their flu shot. This is compared to 82,205 that were vaccinated at the same time last year. So we're doing a little bit better than we were last year, and we still have a ways to go. And I want to remind Detroiters that getting a flu vaccine is more important even now to protect yourself, your loved ones, and your community from flu. So just like wearing a mask, it is so important and easy, and it's a safe action that we can keep ourselves and our family and friends healthy during this pandemic. Essential workers, including nurses and doctors, are doing their part to keep us healthy, and it's now our time to do our part to roll up our sleeves and get vaccinated. Now, the flu shot is available for all Detroiters that are older than 6 months, so 6 months and older. So if you do want a flu shot, there are multiple options for you. You can go to your doctor's office or a local pharmacy, and it's also covered by most insurances. But even if you don't have healthcare insurance, there are many free and low-cost options across the city. In fact, you can go right now to our website at detroitmi.gov/flu shot to find a clinic near you. You can also visit the Detroit Health Department. We have a very robust immunization clinic located in Midtown, 100 Mack Avenue. You can call them right now, schedule an appointment at 313-876-4667. Again, that's 313-876-4667. Now, remember, healthy adults can also get very sick from the flu. So get your flu shot now to prevent the flu, because we are stronger together when we are all protected against the flu. And as Dr. El Sayed said, please make sure that you wear your mask, wash your hands, avoid large crowds, so we can continue to fight COVID-19. And with that, I'll turn it back over to the mayor.
And with that, we'll take any questions.
Hi, Annalise with Cranes Detroit Business. I have a couple questions on enforcement of business violations of COVID, the state rules. Essentially, I just want to know how many citations, or if you could give any details on how many citations have been issued to businesses since MDHHS's November 18th order.
You know the numbers offhand. It's been quite a bit.
Yeah, so we have issued 16 to date. That's as of November the 18th. And it's a variety of restaurants, bars, and local businesses.
But please keep the tips coming in. We have the site. We've had a large number of tips, and the health department and the Detroit Police Department go out and check on all of them. In the last 2 or 3 days, we have seen after-hours drinking types of establishments opened illegally, I think probably in response to the bar shutdown, and DPD is out shutting them down, starting with citations, and will be working to arrest. But in almost every case, it's neighbors calling and saying, this is what's going on. So the fastest way to keep us safe is please keep calling in those tips, and we are on it immediately.
And what about the amount in fines? How many fines have been given out?
The number of fines, we've been given them just about a handful. I mean, they're about $1,000 apiece.
Yeah, they aren't as concerned about the fines as the removal of their business licenses. So the fines are okay, but the business license removal is what is the motivating factor.
And have there been a substantial number of closings?
Yeah.
Ordered closings?
There has. I mean, for the most part, businesses are being responsible. They're following the rules, but there are a handful that are going against executive orders. And so as the health department, we are continuing to enforce, and we are issuing tickets and cease and desist orders so that businesses are following the rules.
We had several businesses that were shut down for a period of time until they came back with a compliance plan that satisfied the health department. And right now, we are seeing some unlicensed establishments pop up, and the police department is doing what they need to do to shut those down permanently.
Have any businesses had their licenses revoked more than once? Or any repeat offenders?
There have been no repeat offenders.
Okay.
First time's been pretty effective.
Okay. And in the past, you guys have not been saying the names of those businesses. Is that still the case?
Yeah, no, so we have not. And, certainly we have a responsibility to our residents who are calling in. And as the mayor mentioned, we're getting about 75 to 100 complaints per day, and we are following up. We also need to protect and support our businesses as well, and we want to strike a balance. So at this point, we have not publicly named any of those businesses at all.
Some other cities, including Chicago and Cleveland, have been naming those businesses. I'm wondering if you can elaborate on why you do not believe that that's in the public interest to disclose those.
I don't know that we've actually had a long discussion about it. It's been so effective to suspend the license for a week or two that we've been accomplishing the purpose. We can take a look at that.
Okay, thank you.
Okay, we have a number of reporters who are watching the live stream and have some questions. Brianna Noble from the Detroit News would like to know what determined the timeline for the extension of the moratorium to 2022 or to the end of 2022.
We took a look at the amount of money we have in reserves from the state, federal, philanthropic help, and the local assessments that we have. And based on our current analysis, it will cover us for the next 2 years. So we are committing that for the next 2 years, there will be a complete moratorium on anybody having their water shut off for lack of funds.
Okay, and Kim Russell from Channel 7 would like to know if we can provide more details on the funding behind those resources, where it's coming from.
So the state of Michigan, I can probably do most of this off the top of my head, but the state of Michigan came through with approximately $21 million. About $15 million helped reduce the arrearages of folks in very low income. About another $6 million went into the plumbing repair aspect of it, which has allowed Gary Brown's folks to go in and fix the pipes. We had about $125,000 from the Kresge Foundation that allowed us for assistance for people who couldn't even pay the $25. And then the 1% that you pay on your water bills is generating us about $3 million a year on top of that. And so it is a combination of local, state, federal, and philanthropic funds. And it shows you the diligence of this administration, the Water Department, and the great leadership from the governor that really has made this possible.
Nashrat Rahman from the Free Press has a few questions. First one being, what happens to individuals at the end of the moratorium if they are behind on their bills at that point?
Yeah, we'll deal with that in 2023. What we're saying here today is we are committed in the next 2 years to finding a permanent solution, so we don't have that conversation. And I'll turn it over to Dr. El Sayed to talk about how we're going to be working together to do that.
So the mayor mentioned the leadership of Senator Peters in working toward a bipartisan solution similar to the way that we fund heating support for folks who may not be able to afford their heating, and there looks like there's some momentum there. That being said, there are a number of different ways to be thinking about this problem, and I really appreciate the fact that we have about 2 years to be thinking about them and to be assessing their capacity to actually solve the problem. And some of those are federal, some of those are state, some of those may be local. But what it's going to take is the insights and the participation and the effort of everyone from the activist community here in the city to obviously Director Brown and the mayor and city leadership, and then our state and federal lawmakers to decide that we're going to make good on this commitment and that we are going to end water shutoffs in the city.
Can I also add that once we get them into the RAP program and we go in and we fix their plumbing issues and get them to an average bill, give them a monthly stipend in assistance, but more importantly, pay down their arrears, the average customer in the state of Detroit that's in that situation will have $700 in arrears, and we will pay that off. And if it's more than $700, we'll put them in the program for a second year, and we'll continue to pay down their arrears. So I suspect that if we get them into the program, we will eliminate large arrearages for most customers.
It's been remarkable. We went from about 75% of Detroiters paying their bills to 92 or 93% today. If you get the payment to an amount people could afford, people will pay that bill. It's when you're giving people $150 and $200 a month bills because their pipes are leaking and they're below poverty that they fall behind. And so we have seen the same thing over and over. When we can deal with the arrearages, when we can deal with the pipe leakages, Detroiters will pay their bills.
Okay, and another one from the Free Press is, are we looking at other examples across the country for water affordability programs, or are you looking more at the national approach now? And what is the quote-unquote policy platform exactly that the city is joining along with others across the country?
So we are finding people from across the country are coming to Detroit for leadership. And I'll let Gary Brown talk about how that's working.
Yeah, I sit on all the national water trade groups and work with all the cities there. And, you know, we can, reasonable people can have a disagreement on the nuances of each city's different program. But we all agree that two things are a fact. Number one, the programs have to be adequately funded, and we need a permanent funding source to do that. Number two, we're all challenged with getting our customers to come in and ask for the help. And it's a very complex number of reasons as to why, but basically, Detroiters are proud people, and they don't necessarily want to come in and ask for help. So we have to do an extraordinary amount of effort to reach out and make sure that they understand these services are available.
Okay. Two questions from Eli Newman at WDET. One for Mr. Brown. He wants to know if you have any estimate in terms of how many service interruptions may be prevented over the next 2 years as a result of the moratorium extension?
Well, as the mayor indicated, 92% of our 227,000 customers are paying their bills on time. That 8% is about 18,000 of our residential customers. More than half of them are not below poverty. They simply need time. They need a payment plan to buy time in order to be able to get caught up. They're an individual that may have had one family member stop working because they need to educate their kids in a homeschooling situation, so their income has come down. They don't need an assistance or any money to do assistance. They're not in jeopardy of being shut off. They simply need a payment plan, and the 1030-50 plan is just that. It will allow them to pay down their arrears over a 12-month or 24-month period. And we have the assistance available for those in the WRAP program. So every single customer has the opportunity prior to today to not see a service interruption if they simply ask for the help and call Wayne Metro.
Okay. After the press conference, Gary, we've got a couple more detailed questions on numbers that the Free Press wants to have answered, but I don't want to put you on the spot if you don't have instant
we'll
recall
get
on
'em.
those, but we'll follow up with them. But the last question for the mayor from Eli Newman from the WDET is whether or not the Biden administration is aware of or has taken any interest in this coalition effort for the water affordability nationally.
So on the call today, one of his co-chairs of his national infrastructure campaign was on the call and very much supportive of this. So I don't speak for the president on this issue, but there's clearly an intent by the new president to have a national infrastructure plan. I think you're going to see water be a part of that plan, but I'm going to let the president-elect speak for himself.
Okay. And that's the last question.
Thank you all very much.